Good evening, everyone. Well, today I'll be talking about bariatric surgery, talking about keyhole, and why did we, in today's era, why to talk about bariatric surgery? One of the commonest thing, living in Middle East, weight loss. Everyone wants to be look slim, trim, and look fit. And coming on to it, it's worldwide because of the lifestyle which we are living. It's not like olden days where for everything we used to move around on a bicycle or walk. The incidence of obesity has increased. The junk food has come into the picture. Our lifestyle has changed. We have more sedentary lifestyle. Everything is done on the desktop, on a mobile app. Even a sales executive, if he needs to do some work, he'll be moving only from one desk to the lift or to the parking and then walking to the next destination. And with the busy schedule, on the go, he'll be grabbing a burger or a pizza as a food. So, all these things have increased the incidence of obesity. Now, obesity doesn't come alone, it comes with other diseases. Weight is only one part. With obesity, you get hypertension, diabetes, have joint pains, infertility. Incidence worldwide has gone up. When we see, what about Middle East? If we are talking about, you see, all the numbers are in 30s, and in the next slide, you'll be seeing comparing, it's UAE is not behind. So when we are talking about in 30%, 32%, it is of individual country that we are seeing in Middle East that more than 30% of the population is obese because of the lifestyle. And it's very common now here. We keep talking, what are you doing on the weekend? Let's catch up for dinner. What's your plan for the weekend? What are you doing? It's been long, we have not met. And weather and everything roams around the food. If we remove the food, we don't have anything else. So, if we're talking about UAE itself, the incidence is almost 27, and recently we have seen obesity even in pediatric population. Incidence have gone up. And these kids are not born obese. We parents are responsible for it. When we talk about gadgets, my child is more prone for the screen time. We have increased the screen time so we can chit chat with our friends. So when we reach home in the evening, we get some peaceful time. We give these gadgets to our child. The child is not eating. We switch on the TV so he can be occupied with the TV and he'll be busy eating. We are moving from one destination to another. We stop on the gas station to pick up a junk food or to pamper. Oh, you have done good in your grades. Today I'll buy you a burger. Today let's go for the pizza date. So we parents are responsible. Now, risk factors. Our joints are made for particular height. This is a joke. A patient comes to the doctor. Doctor, my weight is okay, but my height is less for my weight. So every person, the joints are made for particular height to bear a particular weight. So 100 kg may be good for a 180, 185 centimeter person, but it will be a super obese person if he is 150 centimeter. So obesity comes into it. And if you are 20, 50 kg overweight and you are doing your normal lifestyle, means daily you are bearing 20 to 50 kg on your shoulder. Imagine if I ask you guys, take 50 kg and run, how much we will run? So it becomes a vicious cycle with being overweight. You do exercise, you go to the orthopedician damaging your knee or the ankle. If you don't, and then you get trapped into it. So it has to be gradually and constantly reduced. With obesity, it does come osteoarthritis, depression, and other things. Now, there is a worldwide classification, and the best part of UAE is UAE has come up with a standard guidelines for the hospitals, for the surgeons, not like some part of the world, which I'll not name, that anyone can do any surgery. UAE has been standardized. The hospital should have some amount of surgeries, minimum 60 bariatric surgeries. If it is a complicated surgery, has to be supervised by a consultant. There has to be you are doing a redo surgery, there has to be a consultant involved. So all these things are being monitored in UAE. So that's the best part of it. Now coming on to the treatment, to the audience would like to tell, there was a time when we surgeons used to tell about bariatric surgery. Now is a time there we have seen in last 6 months there has been a drop in bariatric surgery because of the good medical treatment. So there are medical treatment available which are successful, and if it is not, the last option is to go for the surgery. So I've made a pyramid. So basic is the physical activity and the intake. Now many people say that I eat less, still I'm obese. Yes, there are other factors also. When I'm just talking about a lifestyle, junk food, I know this is one factor. They can be genetic, there are hormone, there are other things also. Some parents are obese, definitely the child will have a tendency to be obese. So these are the you get from parents. Genes are also player. There where the genomics come into the picture. I can see Raviraj over there sitting from the Life in 80. Now, diet. Intake, a constant diet, lifestyle is very important. There is a yo-yo phenomena which has been proven. If I am 100 kg, I do diet, or anyone does diet, he will lose weight. We should not be doing dieting. We should be on diet, means healthy diet. If you are starving yourself, you are losing weight, that is not your lifestyle. From 100 you will come to 90, but that is not your lifestyle. One day you'll start eating and you start gaining again back, and this time you will reach more. So from 100 you came to 90, you may climb to 105, again you come to 95, you may climb to 110. These are the stepway proven in medical research called as a yo-yo phenomena. So don't do dieting, do diet along with exercise. Well, pharmacotherapy treatment, as I was mentioning, we do have injections. We were started way back a decade back. We started with tablets, now with injections. Number one is the Mounjaro, which has recently come up. It came up with a treatment for diabetes, and it has shown amazing results, and people are really doing good. Many people have avoided bariatric surgery because of the injection. Best part of the injection is you have to take only once a week. You take once a week, and it's not expensive also. Then there are different options. It's tailor made. So there are varieties of surgery. It is not that we choose the patient, that includes who has comorbid disease, family history, any cancer in his family, and then we plan the surgery for the patient. Balloon is again, there was a time. So what is a balloon? We put a balloon in the stomach, the patient is not able to eat much. So earlier days we used to put balloon. So to put a balloon and to remove a balloon, we had to give anesthesia to the patient. Now there is a capsule balloon. So it's just like a capsule. We give a patient to swallow, and there is a string attached to the balloon with a special marker. We take a X-ray. We make sure that the capsule has reached the stomach. Once it is there, we put a liquid in the capsule. It becomes a balloon. We confirm it. We pull the string out. It just takes 10 minutes. And the balloon occupies your space in the stomach. You are not able to eat much. Best part of the balloon, it has a special valve which dissolves in 3 months. So in 3 months, the balloon also comes out and the patient has achieved the desired weight which he has lost. Or there are some group of patients, they try to do a balloon second time as well. Third time, we have not seen any patient coming back to us. There are different procedures, which sleeve gastrectomy is like just cutting a part of the stomach. I'll not be boring you on the detail of bariatric surgery. Now, the new era, the robotic surgery. Keyhole surgery is making small keyholes and doing a surgery. The same thing is done by the robot. Ultimately, it has to be done by a surgeon only, but it's very good and very nice results, especially on a complex advanced surgeries like cancer surgery and advanced bariatric surgeries. Amazing results. And next era for the new surgeons, new era, it is going to be from keyhole surgery to be a robotic surgery. And that's my hospital. I'm the medical director at International Model Hospital. We have just renovated the hospital and will invite everyone, whoever wishes to see the hospital. It's a 100+ bed hospital and we are known for our surgical specialties. It's known to be a referral hospital, a family hospital. Thank you, everyone.